Welcome back to our channel. Did you know that some common medications can increase the risk of liver damage? Have you ever wondered if the daily pill you take might be harming your liver health? Today's video will reveal surprising information about 10 common medications that can cause liver damage, according to recent studies. Let's explore what these medications are, understand the associated risks, and discover safer alternatives for treating conditions like pain, cholesterol, depression, and infections. This video will provide you with crucial insights that could change the way you approach medical treatment and protect your liver health. Stay tuned until the end because the 10th medication is the most dangerous, and many people take it without realizing the risks. You will be surprised by what you learn. Let's get started. 1. Methotrexate. Methotrexate is widely used to treat conditions such as rheumatoid arthritis and psoriasis, but it can cause liver toxicity, especially with long-term use. Methotrexate can lead to increased liver enzymes, such as ALT, alanine aminotransferase, and AST, aspartate aminotransferase, which are markers of liver damage. This can occur even at low doses commonly used in treating rheumatic diseases. Regular monitoring of liver enzyme levels is crucial for early detection of liver injury. Long-term use of methotrexate can increase the risk of liver fibrosis, a condition characterized by excessive fibrous tissue in the liver, potentially leading to cirrhosis. Regular liver function tests are essential to manage this risk effectively. This preventive measure helps mitigate some adverse effects associated with methotrexate therapy. For patients experiencing elevated liver enzymes or other signs of liver damage, reducing the dose of methotrexate or switching to alternative therapies may be necessary. 2. Acetaminophen, paracetamol. Acetaminophen, also known as paracetamol, is commonly used for pain relief and fever reduction. Although generally safe at recommended doses, excessive use or overdose can lead to severe liver damage, making it a leading cause of acute liver failure. Acetaminophen can be toxic to the liver, particularly when taken in high doses or combined with other products containing acetaminophen. This is because the liver metabolizes the drug, and high doses can deplete glutathione, a substance necessary to protect liver cells from damage. Overdose of acetaminophen is a major cause of acute liver failure, a life-threatening condition. Do not exceed the recommended dosage, typically not more than 4 grams, for 1,000 milligrams, per day for adults. Avoid simultaneous use with other acetaminophen-containing products. Many medications, including cold and fever remedies, also contain acetaminophen, so it's essential to check labels before use. If symptoms such as nausea, vomiting, abdominal pain, or jaundice occur, discontinue the medication and consult a healthcare provider immediately. The use of acetaminophen should be closely monitored, especially in individuals with liver issues or those who consume alcohol regularly. Don't forget to subscribe to our channel to get more helpful health information. 3. Allopurinol. Allopurinol, used to treat gout, can cause liver dysfunction. Regular liver function monitoring is crucial for those on long-term allopurinol therapy. Allopurinol can cause serious liver-related side effects, including elevated liver enzymes, hepatitis, and in rare cases, liver failure. This usually occurs due to the metabolism of the drug in the liver, leading to the accumulation of harmful metabolites. Some patients may experience allergic reactions to allopurinol, resulting in liver issues such as Stevens-Johnson syndrome and toxic epidermal necrolysis, both of which can cause severe liver damage. Symptoms include jaundice, fatigue, nausea, and abdominal pain. Studies have linked allopurinol to elevated levels of liver enzymes like ALT and AST, which indicate liver cell damage. Regular monitoring of these markers is necessary to detect any abnormalities early. To mitigate the risk of liver damage, patients should undergo regular liver function tests throughout their allopurinol treatment. Adjusting the dosage or discontinuing the medication may be necessary if signs of liver damage appear. Consult with your healthcare provider to ensure safe and effective treatment management. 4. Nitrofurantoin. Nitrofurantoin is an antibiotic commonly used to treat urinary tract infections. While effective in treating these infections, nitrofurantoin can also cause serious liver damage, particularly with long-term use or at high doses. Nitrofurantoin can cause liver-related issues ranging from mild hepatitis to severe liver damage, including cirrhosis. The hepatotoxic effects may be due to immune-mediated responses or the accumulation of toxic metabolites in the liver. Symptoms of liver damage from nitrofurantoin can include fatigue, nausea, abdominal pain, jaundice, yellowing of the skin and eyes, and elevated liver enzymes, AST. Jaundice is a distinctive sign of liver dysfunction, often related to the accumulation of bilirubin in the blood. These symptoms may appear after several weeks or months of medication use and can become more severe if not promptly addressed. In some cases, nitrofurantoin-induced liver damage is a result of an abnormal immune response, leading to autoimmune hepatitis. This condition involves the immune system attacking liver cells, causing inflammation and damage. It is a serious condition requiring immediate medical intervention to prevent long-term liver damage. 5. Amiodarone. Amiodarone is widely used to treat arrhythmias but has significant potential for liver toxicity, including leading to conditions such as cirrhosis. This medication can cause both reversible and irreversible liver damage, which is often exacerbated by prolonged use. Amiodarone has been linked to liver injury through its accumulation in the liver, which can lead to steatohepatitis and cirrhosis. This occurs because the drug inhibits mitochondrial beta oxidation of fatty acids, causing fat accumulation in liver cells, which can progress to cirrhosis. The risk of developing cirrhosis increases with higher doses and prolonged use of the medication. The liver toxicity associated with amiodarone is believed to be due to the formation of Mallory-Denk bodies in hepatocytes, which indicate cellular damage. Amiodarone can also lead to phospholipidosis, where phospholipids accumulate in the liver cells, further contributing to liver damage. Patients using amiodarone may experience symptoms of liver dysfunction, including jaundice, fatigue, nausea, and elevated liver enzymes. In severe cases, this can progress to acute liver failure, particularly in patients with pre-existing liver conditions or other risk factors such as alcohol use or metabolic syndrome. 6. Tamoxifen. Tamoxifen is widely used for the treatment and prevention of breast cancer. While effective in reducing the risk of cancer recurrence, tamoxifen can have significant effects on liver health, potentially leading to serious complications. Tamoxifen can induce hepatic steatosis, commonly known as fatty liver disease. This condition involves the accumulation of fat in liver cells, which can potentially progress to non-alcoholic steatohepatitis, NASH, fibrosis, or even cirrhosis if not managed appropriately. The risk of developing fatty liver is particularly higher in patients with obesity, diabetes, or other metabolic conditions. Elevated liver enzymes such as ALT, alanine aminotransferase, and AST, aspartate aminotransferase, have been observed in patients undergoing tamoxifen therapy. These enzymes are markers of liver inflammation or damage, and their elevation indicates that the liver is under stress, potentially from the drug's hepatotoxic effects. In more severe cases, tamoxifen can lead to non-alcoholic steatohepatitis, NASH, a more aggressive form of fatty liver disease characterized by liver inflammation and cell damage. NASH can progress to fibrosis, cirrhosis, and increase the risk of liver cancer. 7. Valproic acid. Valproic acid, also known as valproate, is widely used for treating epilepsy and bipolar disorder. However, this medication carries significant risks for liver health, particularly in certain populations. Valproic acid is known to cause liver toxicity, with the risk being higher in children under the age of 2, patients with mitochondrial disorders, and those with a history of liver disease. The mechanism involves the disruption of mitochondrial function, leading to an accumulation of toxic metabolites that can damage liver cells. This can result in conditions ranging from mild elevations in liver enzymes to severe liver failure. Symptoms of valproic acid-induced liver toxicity can include jaundice, yellowing of the skin and eyes, fatigue, nausea, vomiting, abdominal pain, and unexplained bruising or bleeding. These symptoms can indicate serious liver damage, including fulminant hepatitis, which is a rapid and severe form of liver inflammation. These include infants and young children, particularly those with genetic metabolic disorders such as urea cycle disorders or mitochondrial diseases. Patients with these conditions may experience an exacerbated toxic effect due to an inability to adequately metabolize the drug. 8. Oral contraceptives. Oral contraceptives, particularly those containing high levels of estrogen, are widely used for birth control and other medical purposes. However, they can pose certain risks to liver health, which vary based on the formulation and dosage of the hormones used. Some oral contraceptives can lead to elevated levels of liver enzymes such as ALT, alanine aminotransferase, and AST, aspartate aminotransferase. These enzymes are markers of liver inflammation or damage. Elevated levels may indicate that the liver is under stress or has sustained damage, potentially leading to more serious conditions if not monitored and managed appropriately. In rare cases, oral contraceptives, especially those with higher estrogen content, have been associated with the development of hepatic adenomas. Although these tumors are generally non-cancerous, they can rupture or bleed, leading to serious health complications. Long-term use of oral contraceptives has been linked, though rarely, to an increased risk of hepatocellular carcinoma, liver cancer. Oral contraceptives can also cause cholestasis, a condition where the flow of bile from the liver is reduced or blocked, leading to symptoms such as jaundice, itching, and liver dysfunction. 9. Antidepressants. Certain antidepressants, particularly tricyclic antidepressants, TCAs, like amitriptyline, have been associated with hepatotoxic effects, which can lead to liver inflammation, cause liver enzyme elevations or damage. This hepatotoxicity may manifest as a range of liver conditions, from asymptomatic enzyme elevations to more severe liver inflammation, hepatitis, or even jaundice. The exact mechanism is not fully understood but is thought to involve direct hepatocyte toxicity or immune-mediated responses. Patients may experience symptoms such as fatigue, nausea, abdominal pain, and jaundice if they develop significant liver injury from TCAs. Monitoring liver function tests, LFTs, before and during treatment is crucial, especially in patients with pre-existing liver conditions or those taking other hepatotoxic medications. This monitoring helps detect early signs of liver dysfunction, allowing for timely intervention. The risk of liver damage may be higher in individuals with certain risk factors, including those with existing liver disease, alcohol use, obesity, or metabolic conditions such as diabetes. The elderly and those on long-term TCA therapy may also be at greater risk due to prolonged exposure and age-related decreases in liver function. 10. Herbal supplements. Herbal supplements, such as kava, comfrey, and certain Chinese herbs, are popular for their perceived natural benefits. However, these supplements can pose significant risks to liver health, particularly because they are not subject to the same rigorous testing as prescription medications. Kava is a popular herbal supplement used for its calming effects. However, it has been linked to severe liver toxicity, including hepatitis, cirrhosis, and liver failure. The hepatotoxicity of kava is thought to be related to cavalactones, its active compounds, which can cause mitochondrial dysfunction and oxidative stress in liver cells. Comfrey contains pyrrolizidine alkaloids, which are highly toxic to the liver. These compounds can lead to veno-occlusive disease, a condition where the small veins in the liver are blocked, leading to liver damage and potentially liver failure. Some traditional Chinese herbal medicines, such as those containing aristolochia or certain compounds from the genus Polygonum, have been associated with liver toxicity. Aristolochic acids, in particular, are nephrotoxic and hepatotoxic, potentially leading to acute liver injury, fibrosis, or even liver cancer. Unlike prescription medications, herbal supplements are not required to undergo rigorous clinical testing for safety and efficacy before being marketed. In this video, we've explored the potential liver-related risks associated with 10 commonly used medications, including both prescription drugs and herbal supplements. From acetaminophen and valproic acid to herbal remedies like kava and comfrey, these substances can cause a range of liver issues, including fatty liver disease, hepatitis, cirrhosis, and even liver cancer. It's crucial to understand that while these medications can be effective in treating various conditions, they must be used cautiously, especially in individuals with pre-existing liver conditions or those taking multiple medications. Regular liver function monitoring and consultation with healthcare providers are essential to ensure safe use and to detect early signs of liver damage. Remember, the liver is vital for detoxifying the body and maintaining overall health. Protecting your liver by being informed about the potential risks of medications is a key step in preventing severe complications, including liver cancer and liver failure. Thank you for watching, and don't forget to like, subscribe, and consult with your healthcare provider before making any changes to your medication regimen. Stay healthy and take care of your liver.